Good evening, everyone. Thank you, Achis, for once again telling the guidelines and welcoming us for this event. Um, I would like to begin without any further ado, start by welcoming our esteemed speaker, Dr. B.G. Dharmanand, to the first out of the four-part webinar series this month. Lupus Trust India is organizing, the Karnataka chapter is organizing a four-part webinar series as a part of Lupus Awareness Month in May. Lupus Trust India is a public charitable organization founded in 2018 by lupus patients from Kerala and supported by individuals from all over India. The trust is committed to helping financially disadvantaged patients, particularly those below the poverty line, by facilitating access to affordable treatment and rehabilitation. In addition to medical assistance, the trust also provides psychological, uh, emotional, and social support to those affected. Its core mission is to raise awareness about lupus, offer guidance on medication and lifestyle management, and to ensure that no patient faces this rare disease alone. So, as we know, this year's theme for Lupus Month is lupus treatments, new drugs, and innovations. Are we getting any closer to a cure? Our campaign has already begun with a series of informative posts across our social media platforms and active patient support groups. It is now my great pleasure to welcome our esteemed guest speaker for the evening, Dr. B.G. Dharmanand, one of the most respected rheumatologists in India. Dr. Dharmanand is a consultant rheumatologist at Manipal Hospital, Millers Road, Bangalore, and is also the immediate past president of the Indian Rheumatology Association. His areas of expertise include chronic pain, reproductive immunology, autoimmunity, and bedside teaching. With over 30 years of experience in clinical rheumatology, Dr. Dharmanand has trained numerous successful practitioners, treated thousands of patients successfully, and has been an unwavering source of inspiration to all. He has always been a strong advocate for patients, generously contributing to awareness efforts such as this today. In addition to clinical practice, he's also an accomplished researcher and has co authored several medical publications. On a personal note, it is because of his guidance and support that I stand here today, deeply motivated and passionate about this cause. Thank you, Doctor, for taking time out of your packed schedule to be with us this evening. So, in the section one, we will start with basic terms. There are many new patients who have joined recently in our support group, and there are many being diagnosed as such. But it's always certain terms are very foreign to them. So, could you just explain to us who is a rheumatologist and when should a patient approach a rheumatologist?
It's a very, very relevant question because rheumatology is one of the most recent specialties to have a course or a training program in India. So the rheumatologist, the terminology is not in the popular vernacular of many of our common people because they are all familiar with physicians, pediatricians, orthopedic surgeons, neurologists, but rheumatology is a new name. Basically, rheumatologists are not surgeons. They are physicians. Basically, they have a training in internal medicine, followed by training in rheumatology and clinical immunology for 2 to 3 years, and they get qualified to become a rheumatologist. And what do they treat? They generally treat patients with multi-system autoimmune diseases, joint pains, arthritis. We also call it as a non-arthritic musculoskeletal disorders and osteoporosis. Who should try to see a rheumatologist? Generally, patients are referred to rheumatologist by other clinicians, like physicians, general practitioners, when they come across a multi-system autoimmune disease or an arthritis, which requires further evaluation and expert diagnosis, they are referred. And many times in India, patients are also referred by other patients. And because once you become a patient with the disease, you know about the disease, and you see somebody similar to your illness, then if they are not on the right track, then generally patients in our India, they are usually very concerned about other people and refer. I have had patients referred to me from, say, Kerala by somebody who was traveling in the train together. And they said, you have arthritis? Okay, have you seen a rheumatologist? No. And then they have asked them to see a rheumatologist. So sometimes our Indian natural inquisitiveness sometimes helps people to find the right kind of a clinician.
Definitely, doctor. I know it's improving. I think the approach to a rheumatologist when compared to a few years ago is much more. The accessibility and the awareness of the people, apart from the doctors itself, even the patients, if they have certain type of symptoms, they do approach a rheumatologist sooner nowadays, is what we have noticed. The next question would be, what is SLE? A brief overview of what it is.
SLE is also, if you expand SLE, it is called systemic lupus erythematosus. Systemic is a word to be underlined because it is not only skin deep, it affects multiple organs in the body, and it can affect any system in the body. And lupus erythematosus is a typical terminology which has come from one of the 200-year-old descriptions on lupus skin disease. So people who have only skin disease are lupus erythematosus. When they have systemic disease, they call systemic lupus erythematosus. And the short form is SLE. And it is also known as lupus in common usage. It is a multi-system. Multi-system means it can involve more than one organ system. It can be skin, eye, joints, kidneys, brain, etc. It's an autoimmune disease. Autoimmune disease means body's immune system somehow it has got actually a property of recognizing self as self and not react against our own body's cells. When this mechanism goes wrong somewhere, it starts attacking our own body system. And that these kind of diseases are called autoimmune diseases. And this is not a single disease. It can vary from very simple skin disease only to a multi-organ, multi-system, life-threatening disease. So it is a cluster. There are a lot of clusters. Some people have only joint problems. Some people have skin and joint. Some people have say, fever and kidney involvement. So multiple small clusters are there, but they are all unified into a common name called lupus. Again, lupus is not a we all feel that it is not a single disease, it is a cluster of diseases. And what causes lupus is still a mystery, and it is a disease of young women, and genes play a role. So genes and gender, they have contribute to the development, and when they interplay with the environment can vary from the time when we were in our mom's womb to the day before a patient gets a disease. So, I mean, not day before, weeks before, or months before the patient actually gets diagnosis or gets a first symptom of lupus. So, environment can be from childhood onwards, exposure to infections, toxins, environmental pollution, stress, both physical and mental stress, all can contribute to the development of lupus. So this is a very long answer for your question. So it's the answer itself denotes that this disease is a complex illness.
Yes. Thank you, doctor. Thank you for giving us a brief overview of that. And there are often patients, or during the process of diagnosis, the caregivers often have this guilt that did I cause it or did I do this? So this gives us a clarity that it is not just one factor that leads to the disease. It's a multifactorial whole system that leads you to have or develop this condition as such.